A delicate balance, understanding the vaginal ecosystem. The vagina is an amazing part of the body. It is designed to maintain a healthy environment all on its own. Much like a rainforest or a coral reef, the vagina is home to a diverse community of microorganisms, primarily bacteria. These bacteria, mainly the good kind called lactobacilli, play a crucial role in keeping the vaginal environment slightly acidic. This delicate balance helps to prevent the overgrowth of other types of bacteria that can cause infections, like bacterial vaginosis. However, this balance can be disrupted by various factors, leading to an imbalance in the vaginal flora. When this happens, the bad bacteria can outnumber the good bacteria, leading to a condition known as bacterial vaginosis, or BV for short. Understanding the delicate balance of the vaginal ecosystem is essential for women of all ages. By being aware of the factors that can disrupt this balance, women can take proactive steps to maintain their vaginal health and prevent uncomfortable infections like BV. Bacterial vaginosis, or BV, is the most common vaginal infection in women of reproductive age. It occurs when there is an overgrowth of certain types of bacteria in the vagina, disrupting the natural balance. While BV is not considered a sexually transmitted infection, or STI, sexual activity can increase the risk of developing it. BV is not typically a serious condition and can often be easily treated. However, if left untreated, it can increase the risk of other health problems, such as pelvic inflammatory disease, PID, and sexually transmitted infections. In the following sections, we will delve deeper into the causes, symptoms, diagnosis, and treatment options for BV. The exact cause of bacterial vaginosis is not fully understood, but it is believed to be caused by an imbalance in the vaginal flora. Several factors can contribute to this imbalance, including douching, which disrupts the natural balance of bacteria in the vagina by washing away the good bacteria along with the bad. New or multiple sexual partners can also increase the risk of developing BV. Additionally, smoking can alter the vaginal environment, making it more susceptible to bacterial overgrowth. It is important to note that BV is not contagious and cannot be spread through casual contact. Section 4. Recognizing the signs, symptoms of bacterial vaginosis. One of the tricky things about BV is that some women experience no symptoms at all. However, when symptoms do occur, the most common one is an unusual vaginal discharge. This discharge is often described as thin, grayish-white or yellowish in color, and may have a fishy odor, especially after sex. Other symptoms of BV can include burning during urination, itching around the outside of the vagina, and redness or swelling of the vulva. It's important to remember that these symptoms can also be present in other vaginal infections, so it's crucial to see a healthcare provider for an accurate diagnosis. Section 5. Diagnosing bacterial vaginosis. Diagnosing bacterial vaginosis typically involves a visit to a healthcare provider. They will ask about your medical history and symptoms and perform a pelvic exam. During the pelvic exam, the doctor will visually examine the vagina and cervix for any signs of infection. They may also collect a sample of vaginal fluid using a cotton swab. This sample will be examined under a microscope to check for the presence of clue cells, which are vaginal cells coated with bacteria. The doctor may also check the pH level of the vaginal fluid, as an elevated pH can indicate BV. Based on the findings of these tests, the doctor can make an accurate diagnosis and recommend the appropriate treatment. Section 6. Restoring the balanced treatment options for bacterial vaginosis. The good news is that BV is usually easily treatable. The most common treatment for BV is antibiotics, which are prescribed by a doctor. Antibiotics work by killing the bacteria that are causing the infection. It is important to take the full course of antibiotics as prescribed, even if your symptoms improve before you finish all the medication. In addition to antibiotics, there are also things you can do to help prevent BV from recurring, such as avoiding douching, using condoms during sexual activity, and wearing cotton underwear and breathable clothing. If you are experiencing symptoms of BV or have any concerns about your vaginal health, it is important to consult with a healthcare provider for proper diagnosis and treatment.